Let's discuss myocardial infarction, also called a heart attack. Here's everything you need to know about myocardial infarction. A myocardial infarction, or MI, occurs when blood flow to a part of the heart muscle is blocked. This leads to ischemia, meaning lack of blood flow, to the cardiac muscle tissue. This usually happens due to a blockage in one or more of the coronary arteries. The term myocardial refers to the heart muscle, while infarction refers to tissue death. The coronary arteries are responsible for delivering oxygen-rich blood to the heart. When one of these arteries becomes blocked, usually by a blood clot forming over a ruptured plaque, oxygen and nutrients cannot reach the heart muscle, leading to tissue death. The longer the blockage remains, the more serious the damage. The most common cause of a myocardial infarction is coronary artery disease, which develops due to a buildup of plaque or fatty deposits in the arteries, a process known as atherosclerosis. Other causes include coronary artery spasms and embolisms. Patients with a myocardial infarction often present with chest pain or discomfort, which may feel like pressure, squeezing, or heaviness. The pain may radiate to the jaw, neck, shoulder, arms, or back. A key diagnostic feature of a myocardial infarction is chest pain lasting more than 10 minutes that is not relieved by rest or nitroglycerin. However, some patients, especially diabetics, females, and elderly individuals, may experience other symptoms. In some cases, these might be referred to as silent MIs. These present with atypical, meaning not normal, or minimal symptoms. For example, females often present without chest pain. They may present with nausea, weakness, or other symptoms, but again, may not present with chest pain. Other symptoms of myocardial infarction include shortness of breath, nausea, diaphoresis or excessive sweating, dizziness, palpitations, and a sense of impending doom. A myocardial infarction can lead to life-threatening complications such as cardiogenic shock and cardiac arrest. This makes early recognition and treatment critical. If a myocardial infarction is suspected, you should administer aspirin first, as this will help stop the clotting process and prevent any further clotting from occurring. Then, oxygen, as oxygen will help improve oxygenation to the damaged heart muscle, reducing ischemic symptoms. The oxygen should be administered after the aspirin, but before nitroglycerin. Finally, you should give nitroglycerin, which should be given after the aspirin and after oxygen, as it requires more careful thought before it can be administered. For example, you must check for a blood pressure systolic above 100 and ensure that the patient has not taken any erectile dysfunction medications, also called ED meds, in the last 24 to 48 hours. In addition, paramedics must ensure that the patient is not suffering from an inferior MI. This means that they have to perform a 12 lead. This is again why nitroglycerin should be administered after both aspirin and oxygen. If you didn't already know this, nitroglycerin is a medication that relaxes and widens blood vessels, improving blood flow and reducing the heart's workload. It is commonly used during heart attacks to relieve chest pain by increasing oxygen delivery to the heart muscle. However, nitroglycerin can be dangerous in certain situations. If a person has a low blood pressure, it can cause a further drop, leading to dizziness, fainting, or even shock. If someone has taken erectile dysfunction medications like sildenafil, Viagra, tadalafil, Cialis, or vardenafil, Levitra, the combination with nitroglycerin can cause a life-threatening drop in blood pressure. Additionally, in cases of an inferior myocardial infarction, or MI, which affects the right side of the heart, nitroglycerin can worsen the condition by reducing blood return to the heart, potentially leading to severe hypotension and cardiac arrest. This is why it's so important that we check for contraindications for nitroglycerin before we give it. Here is a quick note. BLS providers can only assist patients in taking their prescribed nitroglycerin. They must ensure that the nitroglycerin was indeed prescribed to the patient before they can assist the patient in taking it. ALS providers can administer nitroglycerin even if the patient does not have their own prescribed medication. Other treatments may be appropriate after these initial treatments are administered, such as morphine administration for ALS providers. Patients should be transported emergently to a cardiac receiving facility. These hospitals can perform percutaneous coronary intervention, or thrombolytic therapy to restore blood flow. Here is a sample scenario where myocardial infarction is the correct answer. Want to watch the full video? Watch the full video and get so much more with your full access membership by going to howtonremt.com or scanning the on-screen QR code now.